Good afternoon. I am Dr. Lotika Purohit, a specialist for diabetes from Mumbai. I have my center in Kolaba. Have been practicing there for the last 20 plus years. Also, I am a visiting diabetologist at JJ Group of Hospitals, and I am attached to Police Hospital and other several hospitals. So, my topic here at IDEC was on painful diabetic neuropathy. Diabetic neuropathy is something which we as clinicians see day in and day out, but however, a lot of times these things are missed. Although we see so many of them, we see patients who come to us with debilitating pain. They are not able to sleep at night because of the pain. They are not able to, this impairs their work schedule because they are unable to function normally because of this pain. And due to this pain, thereafter the numbness, they lose their feet due to an ulceration or even gangrene. So this is something that I spoke about, and how we should look after these patients, how we are able to check them before, avoid, because about 25% of all patients who are diabetics have neuropathy. But what is more significant is that about 11% plus of the patients who have impaired glucose tolerance also have some amount of neuropathy. So if these patients are screened at early time, then they can be, methods can be instituted to slow the progression of neuropathy. Usually this means that the sugar control should be much better, the blood pressure control and the lipid control also has to improve. They can lead a healthy lifestyle, see to it that they exercise on a regular basis and are careful with their feet, check their feet every day to see if there is any cuts, bruises, any other things that are there. However, this is not easy. There are very many criteria to diagnose neuropathy, and there are very many different guidelines as there is no standardization as yet. But what can we do to relieve the pain? So far the medications that we use are either antidepressants, anticonvulsants, or maybe now medications like pregabalin are also available. These are they do go a little way in relieving the pain, but they do not deal with the actual pathology. So far there has been nothing which has been able to treat the actual pathology in painful diabetic neuropathy, and studies are still ongoing. However, in the meantime, if we can control the blood sugars, if we can see to it that the patient lead a healthy life and thereby delay the onset of neuropathy, and definitely see that the patient's suffering is much less.